Thank you very much indeed, Mr. Chairman, and good afternoon, ladies and gentlemen. I'm very glad to be here to have an opportunity to address the first conference in my new role within the Cybersecurity unit. And actually, as you were saying, I was working in the Health and Wellbeing unit of DG Connect for 4.5 years. I've been working generally, let's say, in the IT domain for quite a while before that. And what struck me when I moved to the health unit, the Health and Wellbeing unit, was how IT was essential in helping to transform the delivery of healthcare. So it was a key element, it was an underpinner of the transformation. And now that I've moved to the Cybersecurity unit, some of those efforts will be targeted towards many sectors, energy, transport, and healthcare, not least healthcare. And as I was writing my presentation, I thought to myself how important actually cybersecurity is. It's a key element of the IT, which then underpins the transformation of healthcare. So that's why I thought it was important to give a short presentation on looking at the same sector, the same issues, but through a slightly different lens, and just try to add a sort of a different dimension to the discussion here. As many of you are aware, I'm sure that you read in the press, you read in the newspapers, etc. Healthcare systems are becoming more vulnerable to cyber security attacks and incidents. And again, we have many legacy systems, health IT systems in place, that some of which did not include, or many which did not include, security as a priority when they were being installed. And as a result, that does leave them, in many cases, as you have increased connectivity, and this is linked to the whole issue of breaking down the silos, interoperability, standards, etc. It's all about connectivity. But then the flip side of that in terms of risk, or one of the flip sides, is that it leaves many systems, including legacy systems, open to attack. And apparently I read in a recent study report that cyber criminals regard health data certainly is much more valuable than financial data and information, in fact 20 times or more. And in fact, if you put aside the financial worth of that data on, say, on a black market as such, what kind of data about ourselves is more sensitive than the health data which we entrust to the practitioners and the systems upon which they belong? So this is core. This is a core element for trust by the patients, by the citizens, and by the practitioners, by the users of the technology. If they don't have a trust in it, then I think that's going to hold back the uptake of eHealth, mHealth, digital health, whatever you want to call it. At the minute, we produced an NIS directive, which is basically an EU-level policy and regulatory document which aims at looking at the challenges around digital privacy, digital security across the EU. I'll be talking a bit more about that in a session tomorrow. As of yet, not all member states recognise that eHealth systems are part of the critical infrastructure that is changing, but I think probably all of you are aware actually that now health information systems are now seen as critical and infrastructure in terms of cyber security, as would be transport, finance and others. So some of the challenges we face around eHealth in terms of cyber security are the availability of systems in the first place. If they're hacked, if they're brought down, then they're not available. They're not available in the hospitals, not available to the doctors, not available to the individuals. There are issues around trust and security elements around interoperability, standardisation. Compliance is very important, so there will be standards of compliance of devices and systems to make sure that they comply, that they have a certain compliance level of cyber security. We're talking more and more, and in fact a lot of the efforts that we make at the level of the EU in terms of interoperability and standards is to ensure ultimately that we have cross-border transfer of health information. Now more and more we're getting incidents in member states, but also incident in one member state can cross the border and it can infect other member states. So again, this is very important that we make sure that we have an EU level approach to this. One area that I worked in the health area, in particular when we were working with the US, was in the area of workforce IT skills. And that highlighted, the importance of making sure that all levels of staff and roles of staff, practitioners, support staff, this specialists in IT, that they had a sufficient level of both skills and awareness to implement the healthcare systems. But actually, as part of that, I think that cyber security aspects are key as well, because basically if you don't have a certain level of security within your health systems, then increasingly they're exposed to the risk of being hacked, okay? And worse than that, they could be brought down. And I think this is one thing that we have to watch out for. So things to look at, and if we look at this from a critical infrastructure point of view, business continuity, even in the healthcare area, is very important. Particularly if we look at the central components or services, which are the backbone, and we heard that the term backbone used earlier. Data security and integrity, to make sure that the data acquired from the patients, from the individuals, by the devices, by the practitioners, gets through the system and it is not interfered with, that people can trust that the data is a true reflection of the measurement or the diagnosis which has been made. Identity will be very important, and who has access. Coming back to the area of skills and awareness, apparently a lot of the problems or potential problems within any sector, and the health sector is no different. The human element is very important. And it's important that all the actors involved are aware of what needs to be done and their responsibilities to ensure that they use the correct kind of passwords, that they don't share them with others, and they don't leave systems in a way that they could be exposed to cyber attack from the outside. And one last thing, if you look at it, you want to make sure that you have a sufficient level of availability of a service which does have an impact on society, and that's why it's seen, health IT systems are seen as part of the critical infrastructure, has an effect on electronic health records, and in extreme cases, it might even be linked to patient care, for example, intensive care units where continuity is very, very important. So that's just a sort of context in terms of why, at least from our point of view, cyber security is very important for the area of eHealth, mHealth. To sort of back this up, we had a call for proposals, and this is the first time that within Horizon 2020 we had a call for proposals. It was entitled Increasing Digital Security of Health-Related Data on a Systemic Level. So this is basically looking at issues to ensure that we have the trust of users. If we ourselves are trying to encourage member states and the regions to have their own eHealth action plans, then we want to make sure that we also have an EU level approach to raising the awareness and helping to increase the trust of the individuals and the practitioners. So basically, I won't go through this in detail, but basically it's looking at many aspects. It's about the devices and the architectures and making sure that the acquisition, the storage and the transfer of health data is kept as secure as is possible. You can see here the scope and the impacts, which I'm not going to go through in detail, but we have 2 projects. I can't give you the precise details of these projects quite yet because they're going through the final processes of contracting, but they'll be launched early next year. And you can see some of the overall objectives of these projects. They're about, in scope, in terms of funding, they're about 4 million euros, and they'll take place over the next 2.5 or 3 years. So the results of this should begin to emerge 2019, 2020. So, but looking at a systematic protection of health data against threats and cyber attacks, a definition of a common architecture for secure exchange of health data across Europe's borders. But this is very much linked into what we were talking about earlier, about interoperability, the right kind of standards. This is one of the key building blocks and key elements which has to be part of that. The other thing is a better understanding of the legal and the regulatory requirements in the member states, because don't forget there are quite a few stringent legal and regulatory aspects in the healthcare area, no least for medical devices themselves. So basically, just to show you that we are taking action in this area. We're also active in the Connecting Europe facility, which is looking at more about the rollout and the implementation. And again, I think that we need to look at, in the shorter to medium term, the legacy devices, as I was saying earlier, which some of them have no cyber security protection or very poor level, and I think that we need to find ways in which we can address the increasing number of cyber attacks. Now, looking to the future, I put the word some here because I'm sure there are more challenges than this, but thinking ahead, and this is for work program 2018 to 2020. So this is looking for proposals in Horizon 2020. What should we be looking ahead to? Bearing in mind the rapid changes which are taking place, the move to having a more, let's call it mHealth or mobile devices as inputs to the health information systems as such. So we'll need and the other thing is to maintain the trust in this systems. This is going to be very, very important. So we'll have more dynamic digital healthcare systems, which probably will require more sophisticated and secure ways of storing health and personal data. It's essential to guarantee safe exchange of the sensitive sets of data over a number of architectures. So there's a big thrust here about making sure that there are no silos, but we still will have many different kinds of architectures, and I know that interoperability and standards do play a role in that, but I think that we have to keep an eye on that one. And maybe we need to look at going beyond the current conception of electronic and personal health records, which some people might see as a static repository of clinical reports and data, and to realize a more dynamic and flexible set of electronic health records. And the need for the R&D need for safe, secure, performant and reliable infrastructures which are increasingly distributed and interoperable in a federated approach. So this are some of the challenges. I'm sure that they're not the only ones, but I think this is something which we'll be looking at, and we'll be putting these issues on the table in the work program 2018 to 2020. So that's just a very quick overview of some of the key issues which I think are facing us as regards cyber security in the health IT world. Thank you. I'd be very happy to answer any questions you may have, but I guess that we'll take them with the others.